A very good afternoon to all of you. I am Dr. Sadanand, cardiologist, medical superintendent at Jayadeva Institute of Cardiology, Mysore. Today I will be talking about the ways to protect your heart at home in this coronavirus pandemic. So this coronavirus is a very dangerous pandemic which has gripped, it has modified our lives, and no other pandemic in the recent times had affected us so much. So once a patient develops corona infection, there is risk of developing respiratory problems and cardiovascular problems, and about 1 to 2% of people die because of this illness. And there is a lot of apprehension among the general public, especially among the cardiac patients, about the damage it causes to the body and the risk of mortality if patient develops this infection. So I'm going to talk about how to protect your lives, how to protect your heart during this pandemic. So coronavirus affects mainly the respiratory system. So there is a thing called a cytokine storm. There is a hypercoagulable state where the clotting of blood is increased. So there is clotting of blood in the vessels of the lungs affecting respiration. The oxygen levels fall and the patient may succumb to the illness. And corona also affects the heart. It can cause rarely heart attack. It can weaken the heart and they cause cardiomyopathy where the heart pumping function is less. Patient develops breathing problem and gets admitted to the hospital. Therefore, attention should be given to cardiovascular protection during treatment for COVID-19, both in normal individuals and in patients with pre-existing cardiovascular disease. So we all know that patients with pre-existing diseases like diabetes, hypertension, or a heart disease, so they are at increased risk of developing complications. They are at high risk of dying when they contract this COVID-19 infection, and they should be all the more careful than an otherwise healthy human being. So we all know that as of now there is still no effective vaccine available. There is no sure drug which can prevent the development of disease or treat this disease. And the only way is the social lockdown. It is the only preventive, feasible and effective means of controlling this infection. However, prolonged homestay or lockdown, it is associated with potential side effects which may contribute to increased risk in the cardiovascular diseases. And therefore, the cardiovascular risk factors must be recognized and mitigated in a way without violating the local ordinances. So this prolonged lockdown, people staying at home without going out, moving around, it has got a lot of ill effects on the body. So during lockdown, patient stays indoors. Many homes are very small, so they cannot move around freely. So there is social deprivation. They cannot interact with their colleagues and friends. So they cannot exercise. They lead a sedentary lifestyle. Many IT professionals are working from home, so they are glued to the computer screen. So you tend to watch more of TV, more of social media on your mobile phones. So the diet becomes abnormal. You tend to overeat, put on weight. So because of change in this lifestyle, people tend to develop diabetes, their sugars tend to increase, their BP tends to increase, their weight increases, and because of all this, they tend to develop cardiovascular problems while staying locked up at home. So there can be prolonged eye strain because they're looking at the screen constantly. They can develop muscle aches and pains because they are sedentary. There is hormonal imbalance. Therefore, there may be changes in the sexual life, in the menstrual cycle. So a lot of mood disturbances, anxiety, depression, social deprivation may be there in these patients. All this will take a toll on the body. They tend to develop various diseases. For example, because of physical inactivity, their sugars tend to increase, weight tend to increase, they tend to develop cardiovascular diseases, they can develop osteoporosis because of inactivity. So all this can be prevented at home by taking some simple measures. So you can practice indoor exercises. So a lot of video-based, app-based guidance is available for exercise at home. You can download it, subscribe and follow it. You can use the stairs at home, climb up and down repeatedly. It gives exercise to the body. So you can take measures within the home to counteract physical inactivity, keep yourself healthy. And one important problem, as we already discussed, was weight gain. People need to develop weight to gain 3 to 4 kgs of additional weight because of this lockdown. It has got adverse effects on the diabetes, on the musculoskeletal system, osteoporosis, on the knee joints. So excessive weight has got a lot of deleterious effects on the body. To prevent weight gain during lockdown, people have to consume low-calorie diet, reduce the total fat content, increase the protein content and the fiber content in the diet. You can take dietary supplements which increases your immunity, to increases your capacity to counteract the infection. And when the patients are staying indoors, there is insufficient sunlight exposure. So vitamin D levels tend to decrease, which has got a lot of adverse health effects. Therefore, people need to take vitamin D supplements or diet enriched in vitamin D. There is social isolation, so they can develop depression, anxiety, a lot of psychological disturbances, which has got adverse effects on the cardiovascular system. So to counteract this, now the social media is available very freely. So you can communicate with your friends, get in touch, keep in touch with your family and friends. So this can mitigate the social deprivation effects, keep you psychologically healthy. Now for an otherwise healthy individual also, during this pandemic, escaping from getting infected by coronavirus is very, very important. And if at all you develop a corona infection, protecting from or preventing the occurrence of a heart attack or stroke is also very, very important. So how do we do this? Even when staying indoors, you should continue exercise, eat balanced diet, stay well hydrated, get adequate sleep, and maintain your social network with your friends and family using the available social media. Should get the coronavirus information from a reliable source only. So because of the social media, because of WhatsApp, lots of misinformation is available about the disease and its treatment and prevention. So you should follow the authentic source of information to tackle this pandemic. And avoid drinking too much of alcohol, avoid smoking tobacco. You need to have at least 30 minutes of exercise per day for at least 5 days in a week, which will total to about 150 minutes of exercise of moderate intensity, or half of that if it is a very vigorous intensity exercise. So you take short active breaks during the day, even when you are working from home. Follow an online exercise class. So even within the house, within the compound of the house, you should keep walking. You can do some sit-ups, some yoga exercises, some relaxation exercises, meditation. All these will go a long way in keeping your heart and your body healthy. So when compared to an otherwise normal person, a heart patient, a patient with a cardiovascular disease like a previous heart attack or a heart failure patient, so they are at very high risk of morbidity, mortality, if at all they contract COVID infection. It's very, very important for our heart patients to escape from the infection, and if at all they get infected, to take appropriate measures to prevent one more heart attack or a worsening of heart failure or developing a stroke. So while staying at home, our heart patients should continue taking their medicines. They may not be able to consult their doctor, they may not be able to visit the hospital, get the routine investigations done. their medicine stocks may keep getting exhausted. So in spite of that, till you are able to consult your doctor, continue whatever medicines has been prescribed to you. So you may not have access to the medical shops. Nowadays, online pharmacy is available. You can order medicines online, which will be delivered to your home. Online consultations are available with your doctor. So you can consult them and discuss your problems. So never stop the medicines abruptly just because you are not able to visit the hospital. Some blood thinning medicines like aspirin, ticagrelor or other blood thinning medicines which are given for angioplasty patients, they should be continued indefinitely. So do not stop them abruptly. If at all you stop it, you can end up with a heart attack. And after heart attack, it is very important to modify your risk factors, like the blood pressure to be maintained at normal range, your sugar needs to be normal, your weight needs to be normal, should stop smoking, but limit the alcohol intake, take proper diet and nutrition as advised by your doctor. So even while staying at home, so whatever lifestyle modification, whatever medications was advised and recommended to you by your doctor in the hospital, the same thing has to be continued. So watch your salt intake, limit your salt intake to keep your blood pressure under control. So maintaining a low cholesterol level is very, very important for a heart patient. So avoid fried foods, high fat foods, limit your non-vegetarian diet intake, take more of fruits, vegetables and greens, and exercise regularly, maintain an ideal weight. All this will help to reduce their cholesterol. Many heart patients will be prescribed a cholesterol lowering medication, usually statins. So these medicines also need to be continued. Do not abruptly stop these medicines. Your sugar needs to be controlled, your BP needs to be maintained at normal. So nowadays, the BP and sugar monitoring can be done at home. So you can check your BP and sugar at home. You can interact with your doctor, tell them their readings so that they'll be able to advise you online or through WhatsApp or messages. You can consult your doctor. You need to maintain a good physical activity. So both aerobic exercise, resistance exercises, flexibility exercises like yoga, all these needs to be practiced to maintain a very good cardiovascular health. A minimum of 30-minute exercises per day on most days of the week is recommended to maintain your heart healthy. And taking appropriate meal is very, very important. Staying at home, we tend to overeat. So we tend to eat more junk food, more fatty food. All these are not good for your heart. You should always eat a balanced diet packed with nutrients and vitamins. Avoid processed sugar. Switch to foods which contain natural sugar. Avoid oily and deep fried foods. Avoid spicy foods which can upset your stomach. So even though you're not able to go for regular checkups, you can monitor your sugar and BP at home and consult your doctor online. And any adverse symptoms like difficulty in breathing, chest pain, some discomfort in the chest, giddiness, becoming unconscious, swelling of the limbs. So all these indicate that there is something wrong going on with your heart. You need to consult your doctor immediately. So in this pandemic, we have seen that patients with heart disease, heart attack and heart failure, so they tend to come very late to the hospital, maybe because the conveyance may not be available. They think the doctor and maybe not be available, hospital may be closed. So they come very late to the hospital. So if they come very late in a heart attack, so there is nothing much a doctor and hospital can do to save them. So if at all they develop any adverse symptoms, so they need to visit the hospital immediately. So now a lot of online platforms are available to consult your doctor. So you can download this and you can easily consult your doctor sitting at the convenience of your home. And get adequate sleep. At least 6 to 7 hours of sleep per day is very, very essential to maintain health, to maintain a good cardiovascular status. So therefore, get adequate sleep at home. So stay adequately hydrated. Unless you are having heart failure, you should be drinking 8 to 9 glasses of water per day. So this helps us to flush out all the toxins, maintain efficient flow of blood in the body. And to protect ourselves from corona, so as we all know, we need to wash hands frequently. So cover your mouth and nose while coughing or sneezing. Use a hand sanitizer gel. Try to avoid close contact with people who are unwell. Always use a mask when you are interacting with other people. Do not touch your eyes, nose or mouth if your hands are not clean. Do not shake hands. Do not have many visitors at home. So all this will help you to protect from corona infection, protect you from getting infected. So if at all you are infected, don't panic. You consult your doctor. Consult your doctor, take an appropriate medical advice. So you may be prescribed a lot of good medicines available to treat this infection. So you may be prescribed steroids, you may be prescribed blood thinning agents, drugs like remdesivir, which are very, very helpful in combating this infection. So the key is to consult your doctor early as soon as you develop symptoms and signs of infection. So with this, so we can escape from getting infected. Even if you get infected, consulting your doctor early can prevent complications, can prevent death. So I hope that this talk is helpful for you to maintain your cardiovascular health, to combat and tackle this coronavirus infection. I wish all of you a very good, healthy and a happy heart. Thank you.